I was diagnosed 2007 um, with a fairly large tumor only and went through extensive treatments for about 11 months. But I only found about breast cancer supportive care once I was finished my treatments, and they have really helped me since then, like post um, medical treatments.
Yeah.
Participated in their recovery group, their 12-month or 12-week recovery group, and I see them on a regular basis for like physical exams and just I see Dr. Taylor to discuss different issues and things like that. So um, initially it was the recovery group, um, and and seeing Dr. Taylor, and now it's a continuation of just regular, physical exams related to the breast cancer. Was it was very shocking, and they pretty much threw me into the system, the medical system, right away because my tumor was so large, and they needed to get me into like chemo and all of that. So I went through 6 rounds of chemo, then had surgery, a full mastectomy, and then had another 4 rounds of chemo and then 25 radiation. So they basically, because I was young, I was 42 years old, um, had no history whatsoever, nothing. I had none of they go through a list of what but possibly could have been linked to why I got cancer, and there was no linkage. So, and I was very physically active, like there was nothing that would have indicated. So once I finished all my treatments, I was in a place where your medical doctors kind of let you go, and they kind of say, well, we've done everything that we can for you. We wish you well, and and you're kind of left like, well, like what do I do now, right? When you've gone through that kind of treatment, um, it's like basically going to war. You're battling for your life, and with any war, there's casualties, and there was a lot of casualties. There's physical casualty, emotional, psychological, and that's when I was introduced to breast cancer supportive care. And so when I came in, um, we had to deal with a lot of the psychological in terms of how to put my life together, because you're no longer the person you were when you first started. And you want to move forward, but it's very difficult because you're constantly reminded of what has happened, and what could happen. Reoccurrence is a huge thing with breast cancer patients. Um, it's always in the forefront of your mind, but you don't want to live the rest of your life worrying every step of the way that this cancer could come back and what the implications are. I think it's had good and bad. Well, good and bad. Bad being the cancer. Um, my kids, I think of myself when I was their age, and to be told that your mom has cancer, I can't even imagine what they've gone through, and to have to live with that, knowing that we're blessed that mom is here with us today, but not knowing what the future holds, that is huge. And that's a huge impact on the family, both the kids and obviously Jim, because he, in the beginning it was like, well, is she going to be here next year? Is she going to be here in 2 years? Like when I was diagnosed, Joseph and Alexander were 8 and 10. So it cancer is now part of our life, which is weird to think of it like that. The blessings of it is that I think we've even become closer as a unit, as a family unit, and not that we weren't close, but I think, you just value every moment even that much more. Um, so it's had a huge impact. It's hard to explain in just one sentence.
So we didn't know about breast cancer supportive care
In the beginning.
in the beginning, and through word of mouth we found out about it. So initially, they got us into the system very quickly at Tom Baker. So Tom Baker is very humane. They're excellent, in fact. They're second to none. but they're standardized, almost like the military. You run it through, and they know what to run. So my job was make sure that she got there in time, listen to everything that the doctors were saying. If I heard something that she didn't need to hear or she misheard, I twisted it, basically, because she had to focus on getting chemo, getting better, going to bed, getting up, being healthy. So through that whole process, it was pretty regimental, and my job was to simply stay healthy, stay strong, be with her all the time, and support her all the way through. That's what we did. And then when that ended, through a friend of hers, she found out about breast cancer supportive care. Then she came to me about the recovery group, and she's a bit of an introvert, so she doesn't like to share. And initially,
That's changed though.
Initially, she didn't want to do it, and I said to her that you got to do it. And I talked to her about it. I said, "Look, they've healed your body, but mentally, you're not all there. You're unstable. I mean, at the crack of the word cancer, you collapse at any time. You need to heal mentally, and you need to go." So after a few conversations, she was convinced she had to go, and she went, and it was the best thing she ever did. I mean, it's never left her. Every day she has an ache or a pain somewhere, she always wonders about it, and that's normal, I guess, for everybody. Yeah, I can never relate to that, but it's helped her cope a great deal. And without it, I think she would have had a lot of problems. And it's amazing how sometimes I talk about it with other women or husbands whose wives are going through it. They don't take up the opportunity. It's free, on top of it all, and they don't understand the ramifications that will ensue down the road if you don't get your mind healed as well. Get in touch with breast cancer supportive care as fast as you can. Find out about mental health services, if you want to call it that. How healing the mind, and sooner or later, if you ask those questions in Alberta, especially around here, you will find out about breast cancer supportive.
Because people look at being diagnosed, and I'm sure it's with any illness, but I can only speak for breast cancer. When you're given that diagnosis, it's not just the person who's diagnosed. It's the whole family unit that is now part of that diagnosis, and it affects every one of them. And being part or taking or seeking the help of either a family psychologist or whatnot to address certain issues is invaluable, because, like I said, everybody's affected differently. I know with my two boys, one of them was very vocal in the way he dealt with the issue, with dealing with breast cancer. His way of dealing with it was talking about it. But then I had the opposite. My other son was very quiet. He would not talk about it. He did not want to know about it. He didn't want anything to do with it. So that can actually be more, I believe, can be more dangerous than somebody who's actually talking about it. So it's an invaluable service to have that, because you don't know what's going through their minds, and it doesn't matter what age they're at. Whether they're teeny little or they're in their teens or approaching adulthood, it affects everybody in a different way, and definitely affects the whole family and not just the individual. Yeah, I was going through all the physical, everything, but they were going through a lot of the emotional and psychological part of it,
So
and maybe not even realizing it too, right?
Right.
Yeah. Number one. There's hope.
Well, let's hope.
There's a lot of
7
hope.
years ago, you were diagnosed
Yeah.
with 10-centimeter tumor
Exactly,
With a
and
50
I'm here today.
with a 50% probability of being here in 5 years.
But
Which is
the biggest is breast cancer supportive care is a jewel that we are so blessed to have here in Calgary, because no other city has anything like this. And in order to be able to pick up the pieces after treatment, you need the help that they offer here. And so my biggest advice would be to come here and seek, the services that they have to offer. It's just invaluable. I wouldn't be here to where I am today if it wasn't for them.